been pregnant for 9 months. Now, it's time to give birth. You're having stronger contractions at shorter intervals. As you rush to the hospital, you wonder, what will happen next? How long will labor last? And how will you manage the pain?
Breathe.
This is your body on giving birth. A pregnant person can choose to have an epidural, which is an anesthetic injection in your spinal nerves to block the pain. But epidurals have many side effects, such as low blood pressure or fever. Some people prefer to have minimal medication. For those who go with an unmedicated birth, prenatal yoga and breathing exercises can help lessen pain and build endurance during labor. So, what does unmedicated birth feel like? And when should a pregnancy resort to a cesarean section? Signs of labor. Strong contractions radiating from your lower back to the front are signs of labor. These feel like intense menstrual cramps. Contractions help open your cervix and make it thinner for delivery. This stage can last 12 to 19 hours. Oh, your water just broke. That's another sign of labor. It means the watery fluid that surrounds your baby during pregnancy is now leaking from your vagina. When contractions are coming every 2 to 3 minutes, you should go to the hospital if that's where you intend to give birth. Your doctor will check your cervix and monitor the baby's position. Walking, swaying, or squatting could help the baby move into the birth canal and help distract you from the pain. Your contractions are now longer and much stronger, and your cervix is fully dilated. You might feel nauseous, tired, and shaky, but it's time to deliver your baby. Labor. Your doctor will recommend a cesarean section if your baby shows signs of distress or is too big to be delivered vaginally. A cesarean section means your baby will be born through a cut in your abdomen and uterus. In the United States, about 30% of babies are born via C-section. With a vaginal birth, your uterus acts as a pump to push the baby out of your vagina. Okay, are you ready?
No!
Push! 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 The head comes out first. This may put pressure on your rectum. You might push out a small amount of stool during labor, but don't worry, it's common. Now your baby's head is reaching the opening of your vagina. During this stage, known as crowning, you might feel a burning sensation. You need to push gently to minimize vaginal tearing, or the healthcare provider might practice an episiotomy. It's an incision of your perineum, the area between your vaginal opening and your anus. It used to be a routine procedure, but some studies have shown it may not prevent severe tears, and you could suffer from incontinence, infection, and prolonged pain later on. Okay, you're almost there. Keep pushing. The baby's head is out. Smaller pushes will help the rest of its body come out. Congratulations! You have a beautiful and healthy baby. It's normal to feel achy and tired after giving birth. It will take several weeks to recover fully. Have you ever wondered what it would be like to have 8 babies at the same time? How would your body react?
My nipples are very sensitive.
Would you be more likely to give birth prematurely?
Better late than
Pregnant!
And would any of them be identical twins?
Now I can't tell them apart. Which one's Andy? You gotta be kidding me!
This is your body on having octuplets. In 2009, Nadia Suleiman, known as the Octomom, made global headlines for having octuplets through in vitro fertilization.
That's gotta hurt.
She was implanted with 12 embryos by a fertility specialist. Octomom gave birth to 6 boys and 2 girls, weighing between 800 grams and 1.5 kilos. All 8 babies came from the same sperm donor.
Who's your daddy? Me!
46 doctors and nurses performed the C-section when Suleiman went into labor at 31 weeks into her pregnancy.
Oh, it feels like I'm s***ing a knife!
In this episode, we'll explore what would happen to your body if you're pregnant with octuplets.
I'm not too worried about it, really.
But first, do you know how many babies a womb can hold? 8, 9, 15? Well, stick around. We'll have the answer later in the video. Carrying 8 babies at the same time would require a lot of energy. You'd need to eat the most nutritious food possible
I've never seen you buy a salad.
Because I don't hate myself, Tanya.
and get as much rest as you could. There are no weight guidelines for octuplets because they're so rare, but it's usually recommended that a woman gain between 7 and 18 kilograms when pregnant with a single baby.
I think she's becoming morbidly obese.
Nadia Suleiman gained more than 58 kilograms.
Go put on some more clothes, you
If you were carrying octuplets, you'd have a greater risk of developing preeclampsia, which is high blood pressure and high levels of protein in the urine during pregnancy. And that could damage your organs, including your liver and kidneys. Also, you'd be more prone to getting diabetes during the pregnancy due to your increased amount of hormones.
Crazy hormone swing. Why does everything smell like onions?
Your babies would have greater chances of not growing at the proper rate, called fetal growth restriction. It might cause your babies to be born prematurely
My water broke.
But we'll get you another.
or at low birth weights. It's very common. This problem happens nearly half of the time when there are multiple babies in a single pregnancy.
I ate my twin in the womb.
But the bigger your babies grow, the greater risk you'd face of having squished vital organs. Suleiman even suffered broken ribs during her pregnancy. To give birth to 8 kids in one pregnancy, you'd likely need to give birth prematurely.
No idea how much this hurt.
Which is an incision in your abdomen.
Why does it look like that? You're not a man!
And surprisingly, the birth doesn't need to happen all in one day.
Breathe.
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 Your babies could be born days or even a week apart. This is known as iatrogenic asynchronous birth. The longest known interval between births of babies in the same pregnancy
I'm losing my grip.
was 5 days, 12 hours, and 34 minutes. And now it's your turn, and baby number 8 is born. Congratulations!
You have a girl, unless I cut the wrong cord.
Your babies could be all identical, but so far that's never been documented.
Wow, we're identical.
So you may have some identical twins or triplets, and other babies may be fraternal,
I'm your twin brother.
resulting from multiple eggs fertilized by different sperm.
I'm Nora.
According to the Centers for Disease Control, preterm births and low birth weights accounted for about 17% of infant deaths in 2018. Babies who survive may have breathing problems, developmental delay, vision problems, or hearing problems. Okay, right after giving birth, it would be important to monitor your body.
I still have a vagina.
you'd feel cramps called afterpains. They are caused by the contractions of your uterus as it returns to its pre-pregnancy size.
Sabotage by my baby box.
You'd still be recovering while taking care of your kids.
Either he's crying or I am.
Because of the C-section stitches, lifting anything too heavy would be painful during those first couple of weeks.
Kim John, my hands are shaking.
No, thank you.
And if your tummy still looks pregnant months after you deliver,
I'm not pregnant, I'm just fat.
you'd likely suffer from diastasis recti, which is a separation of the left and right sides of your abdominal muscle. You'd need surgery to fix that. Your hormone levels would drop, and you may feel down and anxious. If your mood continues to worsen for a long period, you could be suffering from postpartum depression. You'd need to contact your doctor in that case.
You hormones, you are a crazy.
In July of 2021, a Malian mom set a new world record by delivering nonuplets. So, to answer your question, a womb can hold 9 fetuses at the same time.
Not necessary.
That's what we know so far, but there's no limit that we know of.
The limit does not exist.
Taking care of your 8 children would not be easy.
Welcome to my nightmare.
Watching ASMR videos may help you unwind, and it might help the babies fall asleep.
This is what a triplet pregnancy looks like. Ouch. Boy, they're really crammed in there. Could one of your babies eat the other in utero? And how painful is it giving birth to triplets? This is your body on giving birth to triplets. And there's the third. Congratulations! You've really beat the odds this time. Triplets occur once in every 8,000 pregnancies.
These triplets are all pregnant at the same time.
How did we get here? Scientifically.
I have coitus with her.
Fraternal multiples are the result of multiple fertilized eggs,
We're twins, the same dad.
while identical babies are the product of a single fertilized egg that has split.
We've been cloned!
You might be thinking the more the merrier, but in this case, it's also riskier. Pregnancy. It's going to be a rough few months. Not gonna lie. Multiple pregnancies have twice the risk of causing high blood pressure, diabetes, and anemia. And 3 times the kicks. That is, if they're all still there. Around half of multi-fetus pregnancies suffer from vanishing twin syndrome, a condition in which an embryo detected early in pregnancy is absorbed by the mother and surrounding fetuses.
I ate my twin in the womb.
The best thing you can do for your babies is to maintain a healthy, high-calorie diet and take it easy. High-impact activities will strain your pelvic muscles holding in the babies. To keep moving, elect for prenatal yoga.
Does the penis get used in this exercise?
The movements and breathing routines will build your endurance and teach you relaxation techniques to reduce pain during labor, which is now. But wait, it's too early.
Take it up with him!
Birth. Don't worry, early labor is pretty typical for multiples. Almost all triplets are born before 37 weeks. A planned cesarean is usually offered for triplets. It's the safest way to avoid entangling the babies and their placentas during delivery. And as a bonus, you'll be given an anesthetic.
Oh, thank you.
Which means little to no pain. If you're one of the 40% that opt for a vaginal birth, you'll want to ask or scream for an epidural. This is going to hurt. After the first baby is born, it can be tricky to know which baby will come next. The doctor or midwife might need to insert their hands into your womb and maneuver the babies into position for you to push them out safely. And before you know it, there they are. Congratulations, you are a mother of 3 beautiful babies. Recovery. Your babies came out a few weeks early, so they'll need extra help eating and staying warm until their organs fully develop. But be sure to take care of yourself too, Mama. Recovering from a C-section will take time. Avoid heavy lifting, get lots of rest, and check in with your healthcare provider about pain relief medication. You'll experience some vaginal discharge and cramping. Your breasts will be tender as they start producing milk, while you also may experience hair loss as your hormones go back to normal. If your pain is more than skin deep, you might be experiencing postpartum depression. Mothers of multiples are 43% more likely to suffer from this condition. Talk to your doctor if you're experiencing severe mood swings, loss of appetite, or a complete lack of joy.
Hey, babe.
Cute.
Motherhood is a challenging journey, but it's also so rewarding. Just be happy it was only 3 little ones. This woman was on her way to a birthing center when her water broke prematurely. With no help in sight and no time to spare, she delivered a healthy 10-pound baby all by herself. Now, she may have been by herself, but she's not alone.
He's coming out.
Giving birth without medical assistance is a worst-case scenario for pregnant people.
I'm sorry, I'm losing my mind here.
But for a select few, it's a dream come true. Why are more and more pregnant people choosing to give birth at home? How can you deliver your own baby? And why could it land you in jail? This is Your Body On, Giving Birth by Yourself. The trend toward non-hospital births has been rising steadily for years.
Get this baby out of me, please.
The number of home births in the U.S. increased by 22% from 2019 to 2020. Social media is awash in pictures and videos of laboring mothers in inflatable pools, surrounded by midwives and loved ones.
Oh, that was amazing.
But recently, a more radical approach to childbirth has taken the internet by storm. Freebirth. Freebirthing is the planned delivery of a baby without any midwives or medical assistance.
It's often assisted birth.
While most pregnant people deliver at home, some opt for more natural environments.
I've given birth outside in the wild.
Freebirthing provides the mother with total control over the birth of her baby.
Oh, here it goes.
I don't feel like anybody else can serve me better than I can serve myself.
It's an attractive choice for those who have had negative experiences with doctors and hospitals.
My first birth was traumatizing in a lot of ways. I ended up having a cascade of interventions, and I felt very unempowered.
Parents who choose free birth are generally against medical intervention during birth.
I just want to be able to fully tune into my body's inner wisdom and just let it happen as it naturally should.
Free birthing can also make intimacy during childbirth more comfortable. Many laboring people have sex to stimulate contractions and relieve pain.
It was very important for me to give birth somewhere that I was comfortable having an orgasm.
Others simply want to avoid the high cost of a hospital birth, which will set you back about $4,500 in the U.S. But these savings come with some serious risks.
I literally thought I was dying.
Risks. Delivering outside of the supervision of medical care may be more comfortable, but that does not make it safer.
Call 911.
Home-birthed babies are 3 times more likely to experience neurological damage and seizures than those born in hospitals. Even scarier, these births suffer twice the infant mortality rate.
It's my fault.
About 10 to 40% of home births require transfer to a hospital due to complications.
I thought I was gonna die in my bathtub.
So it is essential to be aware of any risks associated with your pregnancy before making your birth plan.
Baby's breech.
Pregnant people should not have a free birth if they are carrying multiples, have previously had a C-section, or if the baby is in an improper position. These deliveries are more likely to pose complications, requiring medical attention.
We're gonna do a C-section right away.
But emergencies can arise even when mom and baby are in perfect health.
I literally thought I was dying. I had no idea what was wrong.
Some babies get distressed at the end of labor and are born not breathing.
She's blue.
Kickstarting their lungs is quick and easy for a trained medical professional, but it is almost impossible for an unqualified and exhausted parent fresh out of delivery.
Nothing will prepare you for that moment.
So having a backup plan in the case of emergencies is crucial.
Oh, it's too late.
Planning. If you decide to move forward with a free birth, it is important to be well informed. Knowing the stages of labor,
I think my water's broken.
what they feel like,
I feel her head coming down.
and what happens during each one,
I'm gonna have her fast now.
can help you understand what to expect once childbirth begins. Make sure to monitor your blood pressure at regular intervals during the birth. If it begins to fall, seek medical help immediately. Sudden drops in your blood pressure starve your body of oxygen, which can cause severe organ damage and kill you. So make sure to plan your free birth near a hospital and have transportation at the ready. If your free birth delivery goes wrong, you might face legal trouble. Laws. It is not illegal to give birth unattended by healthcare professionals, but it will ring several alarm bells with authorities. Many doctors have reported women who refuse treatment to social services.
I got a phone call from social services saying that I was putting my unborn baby at risk.
And if your baby doesn't make it, you might face criminal charges. A number of women in the U.S. have been prosecuted, some of them for murder, after delivering stillborn babies at home.
It didn't seem to be that it was treated as a stillbirth. It seemed to be like it was being treated as murder.
These instances are rare, but worth considering when deciding where you would like to give birth. If you get to decide. Emergencies. Not everyone has the luxury of choosing a free birth. People around the world do it every day out of necessity. Like Diana Sanchez. The 27-year-old woman gave birth alone in a Denver jail cell without any medical supervision or treatment.
That pain was it's indescribable.
Diana screamed for help through hours of contractions. She got none.
Nobody cared.
Whether you're in a jail cell or on the side of the road, if you have to deliver your baby alone, here's what to do. Find a flat and steady surface and try to get as comfortable as possible. Sitting or squatting will help gravity do some of the work. Focus on panting. It'll distract you from the pain and relax your muscles to prevent vaginal tearing. Eventually, your contractions will get closer together and can last 60 to 90 seconds.
It hurts.
You'll experience pressure in your lower back and rectum.
I feel like you should push.
Push! When you see the head, place your hands under it for support. If you can, wash your hands first. The baby will have a weak immune system and be susceptible to infections. Guide the little one into a blanket, towel, or whatever you've got nearby. That works. Keep pushing!
You gotta breathe, mommy.
Once both shoulders are visible, gently lift your baby toward your stomach, and the rest will come out.
He's here.
Hold that little love close.
She's so pretty.
Skin-to-skin contact releases oxytocin, which contracts the uterus and reduces bleeding risk.
I feel great.
Cozy up under a blanket if you can. Babies lose a lot of heat when wet, so it's essential to keep both of you warm. The placenta will come out on its own in the next 30 minutes. Don't pull it out. That can cause a uterine inversion. That's when the uterus is pulled inside out, or sometimes even right out of the body. Cutting the umbilical cord is the most dangerous part of the delivery, since it can lead to hemorrhaging. If you have to cut it yourself, wait until it stops pulsating. Tie the cord off tightly with a heavy string about 10 centimeters from the baby, and then again 5 centimeters from the first string. Then, cut between the two ties. You did it!
You were born on the 405.
While hospitals are often considered the safest places to give birth, you have the right to choose how and where your baby is born. But if you're expecting octuplets, I'd think twice about a free birth. How is it even possible to deliver 8 babies at once? We'll find out in another episode of Your Body On.